Hi, it's Kevin Bates here, just recovering from a dose of stomach flu that seems to be working its way through my family, I guess literally actually. So what better time to talk about blockchain and healthcare issues. So a while back, my company helped out with a project launched by FinishNet Solutions and PetMed Data to look at health data for pets, and of course that kind of thing is immediately transferable to human health as well. Ultimately we are animals as well, and I think one of my conclusions from the project is that personally I would not be very happy with my medical data making its way onto an actual blockchain. I think I would always like to see that stored offline in a, well, not offline, but off-chain in a separate database, because although we see databases getting hacked all the time, there's still a lot of work gone into securing them. And if you look at the Finnish healthcare system, they have a very good integration between the doctors' practices and the pharmacies, but there are still some glitches. For example, if I go to try and pick up my kids' prescriptions, I have to have the identification with me for the child. My identification isn't linked to theirs, so there's a problem there. So this is where I think blockchain becomes relevant in terms of identity and access management, IAM, in that if you have your identification sorted out on the blockchain, you can start building links between yourself and other people, and you can start effectively nominating other people that you trust or that you have a guardianship relationship with. And similarly, you can present access tokens to doctors or medical professionals through the blockchain as well. So it does what IAM says, identity and access management, but it does it in a way that the patient can actually own. So if you own your identity on the blockchain, then you have the right to issue access tokens to other parties, and it's you and only you. And it also allows for things such as nomination of guardians, power of attorney, that kind of thing. So in that sense, I think blockchain is going to be very, very useful to healthcare professionals and the healthcare industry in general, and particularly to the patients, because we're all concerned about our data ownership, our rights, and our ability to control our own medical destiny. So that's just my thoughts on this particular topic. There was one final thing I wanted to raise, which is something that seems blindingly obvious to me but is often overlooked, which is you do always have to remember that if you reveal information to another party, regardless of whether it's through a blockchain managed identity system or through a controlled database or whatever, the fact is that once you've made that information available to another party, they have it for as long as they want. You cannot force people to relinquish data unless you take them to court, for example, using the GDPR laws. And even there, of course, there's no real guarantee that they will actually have destroyed it. It takes an awful lot of effort once you've put a secret out there to put it back in the bottle. Anyway, sort of a footnote onto personal data and medical data. Anyway, hope you found this interesting and that I was reasonably coherent given the fact that I'm feeling a little bit under the weather, and see you in the next video soon. Bye for now.